morning, everyone, and welcome. California Baptist University Online and Professional Studies Department of Health Science, in collaboration with the Southern California Public Health Association, is proud to announce the Talking Public Health Series. The purpose of Talking Public Health Series is to improve the field of public health through education, promotion, and advocacy. Thus, our talks highlight special topics in health equity, social justice, health policy and advocacy, and best practices in the fields of public health, medicine, biomedical research, urban planning, and more. Our goal is to impact local and global communities by focusing on timely issues that affect health. Participants learn important information for their professional development and engage in lively, moderated discussions. Attempting to highlight the most pressing local, national, and global health issues, as well as provide a space for discussing emerging issues, the talks often feature presenters from the academic community, community-based organizations, businesses, public health sectors, tech sectors, government, as well as our local, national, and international organizations in an effort to facilitate interdisciplinary discussion on broad topics relevant to public health. I have the pleasure of being your host today. My name is Dr. Dominic Sturs, and I serve as the chair of the Department of Health Science here at California Baptist University and the president-elect of Southern California Public Health Association. Today, I have the great pleasure of introducing you to our speaker, Diane Takvorian. She's led the struggle for social and environmental justice for over 30 years, and thus is the topic today, environmental justice. She's the executive director of Environmental Health Coalition. It's an environmental justice organization in the San Diego-Tijuana region. In 2016, Diane was appointed to the California Air Resources Board. She holds a master's degree in social work with an emphasis on public policy and community organizing. Really excited to welcome Diane today. I know that you're going to enjoy her topic as well as we are. So at this time, I'll turn it over. Diane, welcome.
Thank you very much, Dr. Sturs, and thanks to the Southern California Public Health Association for inviting me to participate today. I'm really excited to have the opportunity to talk with all of you. It's a little odd because there's not much interaction, but I really hope that at the end, when we have time for questions and answers, that you all will ask them and we'll have an opportunity to engage with each other. So today we are talking about public health and environmental justice and that interface that they have together. And our learning outcomes are to learn about both environmental racism, which is the cause of environmental injustice, and to learn about what environmental justice actually looks like and how we can get there. So I'm going to be using examples from the work that Environmental Health Coalition does here in the San Diego-Tijuana region, and hopefully those will be helpful. There are environmental justice groups across the country, and there's a lot of groups here in California that are struggling with similar kinds of issues, but every community is different. And so that's really the beauty of and the distinction of environmental justice. We really grew out of the civil rights and social justice movements, and that makes us somewhat different than the environmental movement. We stand on the shoulders of those who came before us, who have fought racism and poverty, and we are acknowledging the impacts that communities of color and low-income communities have in regards to environmental pollution. So we define environmental justice, as you can see on the screen, in this simple way: the right of all people and communities to live, work, and play in a clean and safe environment. That's our goal. That's what environmental justice is, and it seems very basic and somewhat simple, but it is really a clear goal for our communities, and one that it's a condition that they do not have at this time. And while we're working to achieve that goal, we think that this is a basic human right and something that every community should have should have the right to and should be living in. We at Environmental Health Coalition go a little bit farther to say environmental justice is really the struggle against racism and poverty, that if you don't acknowledge racism and poverty as part of the struggle for environmental justice, that we're only doing part of the job. It's also the effort to preserve and protect the environment, obviously, and our natural environment, but also public health. And what we found early on in the environmental justice movement was that public health and human health was not as well acknowledged as we believed it should be, that people are at risk from environmental pollution as well as our natural places. And I know that that's something that you all work on every day. And lastly, the promotion of social unity and global sustainability. Certainly not a modest goal, but one that says, we have to think not only locally, very locally, as to how environmental pollution is impacting our neighborhoods and in fact our homes, but also think about how environmental injustice affects the rest of the world. And being here on the San Diego-Tijuana border, where we're on an international border, we think about that all the time. What are the decisions that we make here in San Diego or in the United States that affect another country? So that's something that the environmental justice movement keeps in mind all the time. So environmental racism is a form of institutional racism, and we think about it as a subset, obviously, of racism, but something that we believe is clearly in play as we look at our communities and the situations that they are experiencing. So we look at environmental racism as being the policies and activities of a range of entities, from governments, corporations, educational institutions, with the power to influence many people, and either that they have acted intentionally or unintentionally, and their actions result in people of color and low-income people being exposed to greater environmental hazards. There's a lot of discussion in the surrounding the environmental justice movement as to whether or not these actions were intentional, whether someone meant to do it, whether it was simply a matter of economics. But the fact is that when it occurs and it impacts people of color primarily, then it is regarded by the environmental justice movement as environmental racism. And so there, of course, over these more than 30 years of the environmental justice movement being in place, there have been a series of debates, as you might imagine. And one of the first reports that came forward that really served as a point of documentation in terms of what the impacts are on people of color was this report from the United Church of Christ in 1987, Toxic Waste and Race. And the big finding from this report was that race is a greater indicator of where hazardous waste will be than any other indicator. It's a greater indicator than income. It's a greater indicator than any other demographic that you might imagine. So this was really a clear point in the development of the environmental justice movement that said there is data that shows that decisions have been made at some point along the way that say that toxic wastes are in low-income communities of color, well, actually in communities of color, and that's the primary indicator. That report was revisited at its 20-year anniversary in 2007, and the same findings were reiterated when that came forward. There have been some 200 studies that have been done that have resulted in the same basic findings. And one of them came from the U.S. General Accounting Office that found that 3 out of 4 hazardous waste landfills are located in African American communities. So this was a very specific focus in terms of hazardous waste landfills, but it demonstrated the problem in yet another way. As a result of these findings and as a result of communities of color struggling for many years in a variety of places and not finding either governmental response or finding response from more traditional environmental organizations, the environmental justice movement convened the People of Color Summit in 1991 in Washington, D.C. And one of the things that happened at that gathering was that there were a series of principles that were developed. And what you see on your screen are just 4 of the principles of more than 20 principles that were developed as a part of that summit. And they were really those principles that helped to guide the development of the environmental justice movement since that time in 1991. As a result of this work, the President Bill Clinton signed the Environmental Justice Executive Order in 1994, and you see him here signing with a number of distinguished environmental justice advocates as well as legislators. Now, this order said that every federal agency must do its part to achieve environmental justice, and that they must not conduct activities that actually impact in a negative way communities of color and low-income communities. So as we begin to think about, so what is environmental racism and how does it play out, one of the first things that came to be discussed was the idea of cumulative impacts. What we know about our communities is that in communities of color, we generally have low-income communities. We also have communities, as we've said, that have high levels of pollution. They may have inadequate educational systems. We may have inadequate infrastructure, may have problems with land use and zoning, a whole series of impacts that may arise in one particular community. So one of the issues that came forward early in the movement was the idea of cumulative impacts, that no solution can really be reached because if you only look at one issue. If you just look at one factory or plant in a geographic area that is spewing pollution, certainly that facility should be addressed, but you're likely to have many more facilities. There's probably multiple facilities. There may be some of the other factors that I just identified, and that you really don't know what the impacts are on a community unless you look at all of them. So this was discussed in depth with the environmental justice movement, and in 2005, the California Environmental Protection Agency, as a result of work that was done by the Environmental Justice Advisory Committee, adopted this definition that you see on your screen. And this is probably the most comprehensive definition of cumulative impacts that had been taken at least to that time. So it took into account environmental effects as well as sensitive populations and socioeconomic factors. So this began to be identified as the way in which we needed to look at communities that were that may be called disadvantaged communities, impacted communities. And we see on this next slide looking at where those stressors are, how they affect individuals, that they can affect communities as well. And we begin to put the pieces together to say these factors of pollution, of land use, of inadequate education may have impacts on individuals, but they also have impacts on the whole community. So as we began to look at this, one of the outcomes from the Cal EPA Environmental Justice Advisory Committee was to develop something you're probably all familiar with, which is Cal EnviroScreen. And Cal EnviroScreen is really the first and most robust screening and scoring tool that identifies pollution barriers, pollution burdens along with population characteristics to get a Cal EnviroScreen for every census tract in the state of California. So this map shows you what those scores are in illustrating it with color, and that those that are red and at the highest scores, and those that are green are at the lower scores. And there are more than 20 indicators that are utilized to get these overarching scores. This is San Diego County, and as you can see, the urban core, which is the redder part down around the bay, in the lower part of this slide, is the one that this is the map for San Diego, and those that are red and down around the bay are those that are more impacted. This is a more zoomed-in view of San Diego, and this is the urban core, basically, of San Diego, and you can see the purple is actually the most impacted area in San Diego. Environmental Health Coalition was certainly aware of the impacts of these pollutants and different characteristics on communities, and we're 38 years old at this point, and so we've been working in the communities that you see on your map since the beginning, actually. And we are a binational organization. We have an office in Colonia Chilpancingo in Tijuana, but this kind of data isn't available in Mexico, so we can't rank the communities that we work in Tijuana, but we can look at the communities that are in San Diego, and you can see that the ones that we have identified as being the ones that are the most impacted are also those, if you look back at this map, that are the most impacted by the characteristics that are indicated in the Cal-Enviro screen. So these communities are industrialized. They are communities that have freeways crisscrossing them. They have substandard housing and a variety of other issues that need to be addressed, which is why they rank high. You can see quickly here that their profiles, and you can see that all of the communities that we work in have much higher percentage of people of color, families in poverty, very high rate of renters. Most people do not own their own homes, and this is a young population. So these are kids, these are adults of childbearing age, so they have more risks as a result of their age, as well as their proximity to pollution. So if you then look at just people of color in San Diego County, you can see that the areas that are the most impacted per Cal-Enviro screen, which actually doesn't include race, are also impacted, are also communities of color, and those are the ones that are the most impacted. And the same thing is true for families in poverty. And so if we just pull these factors out, poverty is indicated in Cal-Enviro screen. So we know what the problem is, and probably many of you are familiar with that. But what's our goal? Our goal is really to achieve healthy neighborhoods and to have neighborhoods where families can thrive, kids can grow up, and really achieve what they want to in their lives. So we start with children, and we start with children that are at risk as a result of a variety of health problems, but asthma is one of the most striking. And we see this in regards to children's asthma emergency room visits. And you can see that for the 3 communities that were mapped here that are communities we work in, for Barrio Logan, for instance, the asthma rate is 3 times that of the county-wide asthma rate in San Diego, and that's the rate for ER visits. And then another way to look at that would be to be looking at zip codes with more than 5 ER visits by zip code, and the map looks strikingly the same as the Cal-Enviro screen map. So where, obviously, is this pollution coming from? Well, we see that in the same communities and same geographic area that the asthma rates are high, we have the most number of air pollution permits that are indicated by the purple dots, with the red dots being air toxic facilities, so that those are more, they have more serious and health-threatening pollution. And then we can look at diesel, which, again, the map is probably looking somewhat familiar to you, but in this case, we have two port facilities that are in this red area that's right by the bay. So those neighborhoods that are adjacent to the ports are much more impacted by diesel, which is obviously a key pollutant for a variety of ills, but is very important in terms of looking at asthma. So we know that particulate matter, such as that comes from diesel, increases asthma attacks, it aggravates bronchitis, slows lung growth, and a variety of other outcomes results as a result of children being exposed to high levels of particulate matter. And we see here that the abnormal lung function is increased with more diesel exhaust exposure. So where does diesel come from? Well, we know very commonly that it comes from ships, and those ships are docked at the port, from trucks that are taking goods from the port through our neighborhoods and into to wherever those goods are going, and then also from industry. And in our case, we have 3 major shipyards that are located in the port of San Diego that have a high level of pollution in general, air pollution in general, but also a high degree of diesel pollution. There's also a terminal, 10th Avenue Marine Terminal, that's right next to Barrio Logan. And as you're looking at this picture, you can see you look directly across the terminal that's downtown San Diego. And if you are to look to the right of the screen, that's Barrio Logan. So you have the terminal itself, which is where ships come in and trucks are going in and out of, and rail are going in and out of the terminal. And then as you start to see some red coloring, that's where the community starts. So the community is right on top of this major port facility that is bringing in some 10,000 trucks a week that are coming and going to take goods just from this terminal, and there's a similar one that's in National City. So in addition to asthma, from the rail yard itself that's right there next to the 10th Avenue Terminal, there's a strong degree of cancer risk, high cancer risk that comes as a result of the diesel that's coming from the rail. We also have freeways that are crisscrossing the neighborhood, and there's freeway expansion conversations that are occurring pretty consistently, as I know they are in much of Southern California. Obviously, the pollution that comes from not only the trucks but the cars and other vehicles that are on the freeways are impacting the communities, since the freeways literally run right over the communities. And what we also know from a climate change perspective is that transportation accounts for 40% of all of the greenhouse gas emissions in the state of California. So when you look again at another look at San Diego County and you look at who is most vulnerable from a climate change perspective, you see again that those areas that are most impacted are the same ones that you were seeing on the Cal-Enviro screen slide. This slide is only about climate change vulnerability. And there we're talking about the health effects of climate change, where we have, and the two that we really focus on are heat and air pollution. And this slide shows you what the impacts are from climate change in our communities, where we have a low amount of green space. There's not very many parks. There's not many trees. We have substandard housing that does not have air conditioning. It probably doesn't have great insulation, so heat becomes a key issue. And then we've talked about the air pollution that's a co-pollutant along with GHGs and what the impacts of that can be. In our communities, we also have, as I just said, substandard housing, much of which was built before 1978 when lead in paint was banned. And so this map is one that we developed that demonstrates in the one in the upper left-hand corner, young children in poverty, and that map demonstrates the urban core. Then the pre-1950 housing, which is a more conservative look at housing that may be putting children at risk. And then the larger map is those two factors combined. So we see that children in those communities that are already impacted by air pollution, by diesel, are also living in housing that has a high likelihood to have lead paint in it, and thereby they may be being exposed to lead poisoning. So let's look at what do we do, what are the solutions for this? And I wanted to just show you West National City very quickly to say, let's look at a community that took things into their own hands and began to craft some solutions. So West National City is one that suffers from having incompatible land uses, where we have homes and schools that are located right next to industrial facilities because of discriminatory land use practices and zoning. So this shows you West National City. To the left of the I-5 on your screen is the industrial area, so that's all red. But then to the right of the I-5 is West National City, which has a mix of land uses. So you can see that industrial uses have been allowed to be located in a traditionally or historically residential neighborhood. So one of the things that the community began to notice was a high degree of asthma, and they began to look around and say, well, why is that? So if you think about the discriminatory and incompatible land use that I just showed you, we then took a look at specifically the auto body shops in Old Town National City, and found that there were more than 20 auto body shops that were located within a half a mile of the elementary school, which is located in the purple square in the middle of this picture. So those facilities are located right next to homes and schools and have caused not only air pollution that's occurring consistently, and you can see the proximity here of this auto body shop with this home, but we've also had a series of accidents like the one in the lower right-hand corner, and so that's been a big problem. In March 2014, this auto body shop essentially blew up, and it was everyone was lucky because it was a Sunday morning, actually. So there were no workers. It was an electrical fire that was made much worse by the contents of the auto body shop. So the fire started, and then there were a lot of flammable and combustible materials in the shop. But you can see the plume is right on top of these homes that are here in National City. So we began to say, well, this isn't all about environmental regulation. This is about land use and about inappropriate use of zoning. So I wanted to quickly show you a minute-and-a-half video about a way that we began to look at this. So let's see if I can do this.
Yo no sabía que estamos respirando aire contaminado, que podía causar muchas enfermedades, tanta contaminación.
It's a story told across the country. Toxic pollution and deteriorating neighborhoods plague our communities and cause our children to get sick. Mixed-use planning, which allows residential and industrial next to each other, compromises the health and safety of the residents.
No sabía, como mucha gente no sabía, que tenemos el derecho de poder hacer cambios en nuestra comunidad y que si algo nos afecta tenemos el derecho de decir no queremos esto aquí porque esto daña nuestra salud.
For 30 years, Environmental Health Coalition's community planning model has helped communities successfully face these problems. Its 7 steps empower community members to speak for themselves and win healthy neighborhoods. As communities improve, our model ensures residents don't get displaced because their priorities are incorporated into the community plan.
Anyone is free to go to Environmental Health Coalition's website, and that was just a trailer for our Creating Healthy Neighborhoods video program. And it's a 20-minute video that goes through each of the 7 steps, and you're free to download that and utilize it if you have a training opportunity or some way that you want to begin to incorporate land use into your work. And it also talks about how to ensure good community participation and how to develop a community plan. There's also a curriculum that goes with the video. They can be used separately, but it's under our Salsa section. And you can register and then you can download the curriculum, which also uses the 7 steps. So, and you can use any part of that. You don't have to do the whole curriculum, which is 8 sessions. So we're trying to make that available so that people can have those tools if they're useful to them, and learn from what we've been able to do and what we've learned from and what some of the challenges are in that regard. And then also, what we really hope, we know that people are evolving this work and that folks have other experiences that would be really helpful for other folks to know about. So we ask that folks that use the curriculum or the video give us feedback on how we can improve, but also information that we can share across the country for everyone who's subscribing. So the major strategy here is that community members are planning their own communities. And so we began a community planning process in the city of National City in the west side. So there's a specific plan that was developed, and we did training for community members on basic land use practices because most people are not land use planners. And so they learned about what is zoning and what is planning and what's incompatible land use and what are each of the different kinds of aspects of zoning and how can we apply it in our communities. And so in 2010, the West Side Specific Plan was adopted, and actually the plan was adopted in such a way that zoning was changed so that there's no longer any mixed-use zoning. There's in residential, commercial, and industrial zoning, and it's separated out. The goal was to really begin to clean up the community. So that you'd say, well, but those 20-plus auto body shops are still there, and they are. But what we also did was the City Council adopted what we called an Amortization Ordinance, and that ordinance basically gives the City Council the right to evaluate businesses that are a threat to public health and to the environment, and to phase them out, essentially cause them to relocate. So we worked with the US EPA, who provided a grant to the City of National City to develop this amortization model. And all of these factors were put into a model. and 100 companies that were within a few miles of the elementary school on the west side were evaluated according to these factors. And as a result of that, a ranking was made of all of the companies. And as a result of that work, there were 2 companies, which you see on this slide, that have actually been phased out and relocated. One actually went out of business, the other relocated. And what's included in that is, in the analysis, is that there is there's an analysis of how much value the business has and how much investment has been put into it. So there is a opportunity for the business owner to recoup their investment by the amount of time that's provided to them to actually relocate or phase out. The other part of this model that we are working to accomplish, and we haven't done so yet, we've taken a couple of steps in it, is we're looking at how do we create a space where these industries can locate and can prosper, because we want to think about the economic impacts of these businesses. They're there legally. The city said they could be in those locations. So it's not through any fault of their own that they are that they're right next to a home or right next to a school. So we're investigating starting a green auto body park on what would be the bay side or the west side of the I-5, which is all industrial, as I showed you in a previous slide. And we would, those companies that were amortized and were interested in moving would move then to this green industrial park. So we've been able to do an initial assessment of that to see about its feasibility, and we're still working on that. So the other piece of the success story, I guess, or the evolving success story, is restoring Paradise Creek, which runs right through the west side of National City. And this is a creek that has long been neglected and contaminated as a result of industrial and other human activity. On the left side of your screen, behind the chain link fence, that was essentially a dump site that the city was dumping trash and hazardous materials went there as well, and they served to contaminate the creek. So we were able to get approval for 201 affordable housing units that would be located near the creek, but enough away from the creek to protect it. And these housing units have now, the first phase has been built. The first 100 are built, and the second 100 are under construction. And the exciting thing is that all of the units are inhabited by National City residents. The City Council put a priority on having those city residents have the first preference when they were registering to be able to live in affordable housing. And the list was very long, so it's really needed. And then the last thing I just wanted to say in terms of the solution-oriented approach is the west side of National City, which is what this community plan has been, that I've been describing is about, is just one part of National City. So in the general plan, the city adopted a health and environmental justice element that included these 6 areas, and it was the first one in the state to adopt an environmental justice element. In 2016, the state of California adopted SB 1000, which actually requires all cities to adopt an environmental justice element as part of their next general plan adoption. So that's exciting to see the work that has happened locally be bumped up to the state level, and to hope that it benefits other communities. So thank you so much for your attention, and I hope that this has been helpful to you, and I'm looking forward to your questions.
Thank you, Diane. That was certainly enlightening. Today, we're going to open it up at this point for our question and answer section. So for our attendees that are out there, if you look in your upper right-hand corner, there's a Q&A button. You can go ahead and ask questions now through that, and Diane will stay here with us for several minutes that we can address any questions about her presentation that you may have. So go ahead and ask questions now. And the first question I have is related to, interestingly enough, because of the area that you're covering, it's relating to the building of the wall and wondering how that might affect environmental justice for people living close to border cities, if you have any comments on that.
Yeah, the prototype border wall project, if you want to call it that, is happening right here in on the San Diego-Tijuana border. So those prototypes are actually standing, have been built, and are apparently being evaluated. So the community in the area where those walls are being built, they're not super close to residential community. So there's not that immediate impact, but certainly the whole discussion of the wall, the idea that it will be built throughout the border, but of course, especially here in the San Diego-Tijuana region, is having a chilling effect. And I'm sure you're all very aware of the impact it's having on immigrants who are living here in San Diego and throughout California, as well as the impact for people who cross the border regularly for work. There's a good number of people who work in San Diego who live in Tijuana. So the impact is both legal and very real in terms of the physical boundary. It's real from an economic perspective in terms of what dollars are going to be spent, and frankly, the flow of federal dollars to the border region for all kinds of projects, but particularly for environmental projects, has essentially stopped. So preserving the border environment, actually tending to it, has really been halted. So that's another impact, I think, of the border wall. And certainly it has a chilling psychological impact when we're working to open our borders, in the sense of we have opened them economically, that we want to open them culturally, that this is really moving in the opposite direction. So there's a lot of discussion of it in our communities.
Thank you. The next question is a two-part question. The first part asks what young public health professionals can do to really get involved with helping eliminate some of the environmental justice issues. And the second part of that question asks how do they get other individuals involved with projects that may make a difference?
That's a great question. I would say that environmental justice organizations across California are really desperate for public health professionals. So I neglected to say during my talk that Environmental Health Coalition is one of the founding members of the California Environmental Justice Alliance, and that is comprised of environmental justice organizations throughout California, about 15 organizations from San Diego and to the central and inland valleys through LA and the Bay Area. And all those organizations are working together to try to adopt state laws that can benefit our communities. And we really need public health professionals to be helping us. So I think finding out what environmental justice organizations are in your area would be a great first start, and to begin to work with them. Our research director is a longtime staffer, more than 25 years, and she is a master's in public health. So her background in public health has been enormously helpful to us, and something that I think every environmental justice organization can benefit from. And certainly once there are public health folks in an organization, you can attract others to be in your, to help as well and be involved.
Great, thank you. The next question I have is coming. It's asked if there's anything being done that you know of on the United States end to address the pollution that's coming out of Mexico by way of the Tijuana River. This attendee said they saw in a news report that pollution is starting to be increasing, but it also suggested that maybe Mexico isn't doing what they're supposed to be doing, and there's, I guess, some discussion with NAFTA that's currently going on. So is this a topic you're familiar with and can address?
Yes, the Mexico and Tijuana in particular has a very substandard sewage system. So when it rains, which is primarily when we have problems, the sewage system in Tijuana is overwhelmed, and that overflow goes into the Tijuana River, which is a north-flowing river. So it goes into the river, which runs throughout the city of Tijuana, and then flows north into the southern part of San Diego into Imperial Beach. And so it's contaminated the beach there as well. And so, no, Mexico isn't doing what it should be doing in order to control that pollution. And that's been a subject for as long as I can remember. There's a sewage plant that was built by the U.S. to not only control U.S. Sewage, but also Tijuana sewage, but it has become overwhelmed as well. So it's an ongoing problem and one that really needs to be addressed. And I think the relationship with NAFTA, I don't know that I would say there's a direct relationship, but I think what we have to pay attention to is that we have a third world country in Mexico that is a trading partner with the United States, and yet it's a third world country, so they don't have the infrastructure, and there weren't provisions, even though many of us asked for them to be when it was adopted in the early 90s, for infrastructure to be built and there to be assistance for that. Because as the population grows in Tijuana, because those jobs from the maquiladora industry are there, then there's a greater burden on the infrastructure, both the roads as well as the sewer systems, and that's helping to create this situation.
Thank you for that. The next question reads, many homes in Southern California have lead and asbestos, but oftentimes the families that live in them cannot afford to have the toxins removed. Are you aware of any plan for a program to help residents remove these types of substances from existing homes?
Yeah, that's another great question. We've been working for more than 15 years with the cities of National City and San Diego to apply for grants from the Federal Housing and Urban Development Department. And as a result of that, we've actually raised more than $30 million over those years to educate folks about whether or not they live in a home that contains a risk from lead or from mold or from asbestos. And then the majority of the money goes to the city, who then manage contractors who actually are able to remediate the lead hazards. So it requires that the residents be low income, and that those housing units that have children in them are prioritized higher. But there are federal resources, and unlike other parts of the federal budget, this part of the budget is actually getting increased. So I would encourage you to look into that, because I think federal dollars have been the primary way to enable people to address those hazards.
Thank you. The next question asks, would you say the refugee community in San Diego is affected similarly to the communities we discussed today?
Well, the communities that we discussed today are refugee communities. I think the larger, not the larger, another community that has a large amount of refugees that we didn't talk about today is City Heights. And that is located so if you look at this map and you see the City Heights here in the blue, that's a community that has a large refugee community. The largest percentage of folks who live in the community are Latino and Spanish speaking, but there's large communities of East African refugees, as well as those from the Middle East, from Vietnam, and so it's quite a mix. There's over 50 languages that are spoken in City Heights. So this is not the industrialized area, so we don't have the same problems that we have in Barrio Logan and West National City, where it's more industrialized. It's on the bay, it's next to the port. What is true is that there are a variety of freeways that crisscross that neighborhood. So there's a lot of pollution that comes from the freeways. There's inadequate housing. There's a lot of lead poisoning in City Heights. And we work largely on transportation justice issues there because we don't have good transit that goes to that community and that takes people from there into the employment centers in San Diego. And it's very difficult to walk and to bike there. City Heights has some of the most dangerous, intersections in the city of San Diego, according to recent studies.
Thank you much, Diane. Well, at this time, I don't believe there's any other further questions. So for our audience, if those of you who are CHES certified, whether it's your CHES or your MCHES, and if you're looking for continuing education units, please use your full name and CHES number via this Q&A chat, and we'll make sure that we register that for you. I want to thank you all for attending, especially thank you, Diane, for your expertise and knowledge today. I know I certainly learned quite a bit, and I'm sure all of our attendees did as well. It was a pleasure having you. On behalf of Southern California Public Health Association and California Baptist University Online and Professional Studies, we bid you adieu. Have a blessed day.